So is it true that every woman with PCOD will struggle with infertility, or is it just a misconception we need to break?
No, not every woman with PCOD will have infertility. Uh, there will be some women who can get pregnant spontaneously. There will be others who will need some medications for their treatment. And also, there will be some who will need injections. And those who will need injections, at some point, they will need IVF. So it's not, same size fitting all.
In today's case, we can say that male infertility is often seen as a silent side of the story. Is it a myth that infertility is basically related to female?
Male infertility is involved in around 40 to 50% of cases. So it is not true that only the females are to be blamed for infertility. Roughly around 30% of male who are young suffer from the semen parameter abnormalities, and that is because of the modern day lifestyles, their smoking, the alcohol habits, the drug. Apart from that, they also have the problem of sedentary lifestyle, obesity, junk foods. So all these things are being practiced by the younger adults. So there is a lot of cases where you get infertility because of this.
So we can say fertility is not about how healthy you look. Does freezing your egg at early 20s or late 20s actually pauses time?
It actually pauses time. What happens is you freeze your egg at the age of 27, and then at the age of 35, 37, you want to use your egg to get pregnant. So your egg is frozen at the age of 27. So you get a better quality and cohort of egg, and your chances of pregnancy increases with that.
So we can say that egg freezing does not only stop time, it actually stores the moment of your fertility.
Yes, you can say that.
Hello everyone, and welcome to our podcast Fertility Unfiltered, where we are going to break myths related to infertility and bring science closer to you. Today's topic of discussion is about PCOD, male infertility, and egg freezing. Today we have special guest with us, Dr. Biplab Roy Chaudhary, who is clinical director at Calcutta Cure Line, who is going to break all the myths related to infertility and bring science closer to you. So first we are going to talk about PCOD.
Yes.
So is it true that every woman with PCOD will struggle with infertility, or is it just a misconception we need to break?
No, not every woman with PCOD will have infertility. There will be some women who can get pregnant spontaneously. There will be others who will need some medications for their treatment. And also there will be some who will need injections. And those who will need injections, at some point they will need IVF. So it's not same size fitting all. It's like PCOD, and you have to customize them.
Sir, is egg freezing something women with PCOD should consider, or in any specific condition?
No, not that all women with PCOD need to have egg freezing. It's a good option, of course, but what we need to say is like that PCOD women who have had pregnancy at an earlier age, like 27 years, when she had IVF, she had her eggs frozen at 27, and now she is trying to get a second pregnancy, which she is not getting automatically because of being PCOD at 35. So she can use her frozen eggs, which are frozen at the age of 27, to use for their second pregnancy. So egg freezing is a good option for PCOD also.
So sir, we can say that egg freezing in PCOD is basically about planning. It's not about panic.
Definitely, yes.
Sir, there is a belief that irregular periods automatically means PCOD. Is it true?
No, it's not always, because there are several other conditions where you could get irregular periods, like polyp, like cervical conditions, like any malignancies or any miscarriages and hormonal imbalances. We all have to see locally and also do the blood tests to find out what is the cause of irregular bleeding, and also do the hormonal profile. Your doctor can guide into getting it into the right directions.
Sir, many people think that birth control pills cures PCOD. How true is that?
Birth control pill does not cure PCOD. What it does, it regularizes the periods. It also reduces the male hormonal pattern and the associated conditions with the increase in male hormone like acne, hirsutism, oily skin, etc. So that way it is helpful, but it does not cure. Once you take it off, PCOD will come once again. What we'll have to think and do is, like for PCOD women, we will have to consider the lifestyle management, the weight reduction if there is increased weight, and also do regular daily exercises, eat healthy food, so that there is weight control and the disease is at control. The disease can be controlled, but it cannot be cured. So the disease has to be controlled, because in the long term, if you do not control them, then they will have these diabetes and dyslipidemias, where you get heart problems at an older age, and also infertility when you try to get a child.
So, our next topic is about male infertility.
Right.
In today's case, we can say that male infertility is often seen as a silent side of the story. Is it a myth that infertility is basically related to female? And what is the actual percentage of the cases that are actually male factor?
No, you see, male infertility is involved in around 40 to 50% of cases. So it is not true that only the females are to be blamed for infertility. The problem with males are they do not want to get investigated. They also do not want to get treated or follow much of our advice. What we suggest is that they should have at least a semen analysis, which should be taken in the place where the semen analysis is being done. And sometimes it is also difficult to procure the semen samples because they are in a out of the place situation. But after counseling, I think people can definitely do semen analysis, and also there are some battery of other tests that needs to be done to find out what is the depth of male infertility.
So we can say that fertility is not it's a shared journey. It's not about we have to blame females only.
Yeah, that's true, absolutely true.
People often think that older men faces fertility issue. Is it true? Can young or healthy male can also face infertility?
Yes, roughly around 30% of male who are young suffer from the semen parameter abnormalities, and that is because of the modern day lifestyles, their smoking, the alcohol habits, the drugs, ganjas, other illicit drugs, and sometimes because of their their occupations, like they are sometimes handling the pesticides. Some of them are the truck drivers who are constantly exposed to the heat, and also some of the IT personals who are using laptops for long hours and also keeping them on the lap and so on. Apart from that, they also have the problem of sedentary lifestyle, obesity, junk foods, smoking, as I said already, and alcohol. So all these things are being practiced by the younger adults. So there is a lot of cases where you get uh, infertility because of this.
So we can say fertility is not about how healthy you look.
No, it's not, because it is at the level of the microscope.
Microscope.
So microscopic levels that shows as to how far you are fertile. So there are hosts of tests. Ordinary semen test may be normal, but there are hosts of other tests like DNA fragmentation tests, the Hoss test, and other tests which goes to show as to what are the defects, where is the damage in the sperm, and how it could be mitigated, and things like that.
So in the recent trend, we can say that is there is a declining in sperm count.
Yes, in the recent years, we found that WHO, which is the World Health Organization, have reduced the levels of the number of sperms to be normal from 20 million to 16 million. So definitely there is a reduction worldwide of the sperm count. And the reasons are various, as we have discussed earlier on, the lifestyle and so many other things, the environmental poisonings and smoking, obesity, diabetes, and so on and so forth.
So how does this male infertility basically impact their mental health and the relationship among the couple? Like this is very rarely discussed in open area.
Yes, many male, they consider that infertility is associated with their masculinity, and there is a lot of ego going into it. So they are depressed if they are infertile, they are depressed if they cannot have proper sex, and that is why they feel depressed, they go into the psychological trauma, and those things need to be addressed and counseled properly.
Thank you, sir.
All of these could be mitigated, you see, all of these could be mitigated by proper counseling, psychological counseling, counseling by the gynecologists, the andrologists, and they could reduce their smoking habits, the stop alcohol, any other drugs that they are taking, and also do various exercises to reduce their weight, control their diabetes, and that's how they can mitigate their infertility. Their sperm counts will also improve if we do that.
Sir, so our next topic of discussion is about egg freezing.
Right.
Does freezing your egg at early 20s or late 20s actually pauses time?
It actually pauses time. What happens is you freeze your egg at the age of 27, and then you go on to do your PhD or whatever you want to do. Then at the age of 35, 37, you want to use your egg to get pregnant. So your egg is frozen at the age of 27. So you get a better quality and cohort of egg, and your chances of pregnancy increases with that.
So we can say that egg freezing does not only stop time, it actually stores the moment of your fertility.
Yes, yes, you can say that.
Sir, still in today's era, egg freezing is still considered as a luxury choice. Why is it so?
Yeah, not only luxury, it is sometimes looked upon as a taboo. So, what happens is, like nowadays, women who are mostly careeristic and they are either studying or going for higher studies or PhDs or going for office jobs or management programs. So, their biological age is being lost. In the process, the quality of the eggs diminish as they age. I mean, it's a very good choice that science has given, that you can freeze your egg at whatever age, 27, 28, 29, and then go on to use them at a later age when you actually want them and you have a partner also. So that way it is a, I would say, very good gift of science which most career women should adopt so that they get a healthy child.
Sir, actually, what can be the process of it? Is it a painful process?
For doing the freezing?
Yes.
No, it's actually not, because nowadays we use modern day anesthesia and also very good painkillers. So you have to have some injections and get your eggs to be extracted under anesthesia. There could be some pain which is mitigated by medications, and then only for a day you will be out of your sort, and the next day you can very well go ahead and do all your work. So it's not a very painful process at all.
Sir, one more misconception that people think that freezing your egg actually kills natural fertility. Is it true?
No, freezing your egg does not kill your natural fertility. What it does is, like, if you have frozen your eggs at the age of 28 or 27, then you get a good cohort and good quality of egg which is waiting to be transferred into your womb at whatever age you want. But if you try, or you get married at 35 or whatever, and then you try to get a pregnancy, you may get a pregnancy at that age also. If you don't get, you have a backup of your eggs which is frozen at 27. So that way it is a very nice gift, I would suggest.
So we can say that it does not actually take away your natural fertility, it is just an extra option.
Yeah, it gives you an extra option. And also sometimes what happens is, for Indian women, the fertility diminishes drastically after the age of 35. So if you are late, say 37, 38, to get married or want to have a child at that age, sometimes your egg quality becomes very poor because of your age. So in that case, if you have your eggs frozen at earlier age, say 28, 27, then you have the option of using them and get a pregnancy. So what we can say is, we at Calcutta Cure Line, we freeze your egg, we freeze your time, and it is a wonderful gift if you don't mind.
Thank you, sir, for clearing all the misconceptions related to infertility. Sir, any take-home message for this?
Yes, actually we are doing all these things at Calcutta Cure Line, and we are doing these counseling for the male infertility, and a lot of patients who are PCODs are being sorted at our clinic, and we also do egg freezing. So anyone who is interested could come down at Calcutta Cure Line so that we can treat them.
Thank you.
Thank you.